Hey, good evening, everybody. Thanks for joining us. I'm going to give folks a few minutes to trickle in here, but we're happy that you're with us. This is week 3 of our fall webinar series for Master Beef. So a lot of you have been joining us live, and some of you have even been joining us on our recordings after these sessions are over. So we really appreciate your participation. We appreciate the folks that are out there in the county offices, having people come in and watch that way, or those of you that are watching from home. So we're going to go ahead and get started here in just a minute, but a few housekeeping things before we do. Just as a reminder, at the end of the webinar, when you watch live, a survey link will pop up. As soon as you close the webinar, it will pop up in a browser. And you will also get a follow-up email a day after the webinar with that survey link. And those are the same survey. It's just 2 opportunities to take that survey. But the survey does not count as your attendance. So as long as you are logged into the webinar watching, or you watch the recording, the survey is an optional thing that allows us to just gather feedback and make sure that we're doing a good job with these webinars. So please certainly take it. We want to get your feedback and know how we're doing. But just, to make clear that the survey does not mean anything about your attendance. So if you do not get a survey link for some reason, or if you're watching the recording, you will not get a survey link. And I just want to make sure that everybody knows you're still going to be counted as present as long as you've been logged into the webinar, either live or registered for the on-demand recording. So with that, looks like most of everybody is logged on. So tonight we're doing things a little bit differently. We're going to cover the topic of over-the-counter antibiotics and the changes that are coming up associated with that. You'll see that we have Dr. Strickland online with us, but we're going to play a recording of this presentation that he gave recently about this topic. And then once we finish that recording, we're going to open it up for questions for Dr. Strickland. So with that, I'm going to go ahead and get this set up. You'll have to bear with me for a minute while I get the video playing. But I'm going to share this and we're going to start watching. And then once we get finished with the recording, we'll open it up for questions from everybody. So we're going to go ahead and get started.
Really nice to be with you on this a nice day here. Even though I have a topic that not a lot of people are going to be excited about, but it's something that we've got to adjust to, something that's coming, ready or not, bend over, here it comes. So I just want to go over a few things here as far as some of the changes that are coming up, what's required, what is going to be affected, what is not going to be affected, and just some of the things that you'll need to do to plan ahead of time to try to prepare for this upcoming regulation. And certainly, as Dr. Mason was saying there, feel free to ask questions. I'm perfectly fine if you ask questions as we're going, but if you want to just put them all in the chat box, we'll have a question and answer session at the end. So however you want to do it, I don't know that I'll be able to fill up the entire hour with this, but certainly I want to leave plenty of time for questions. I want you to clear your mind of questions and anything that you can think of to come up with. If I don't know exactly what the answer will be, I can certainly find out for you and get back with you, because there's no telling how many times a day when I'm sitting in my office answering phone calls that I say, well, I don't know the answer to that, but I'll be glad to find out and get back with you. Just a little bit of history of what has led up to this point that we're coming into right now. Back in 2012, excuse me there, I can't talk without a pointer. Back in 2012, we had the cephalosporin extra label prohibition. So we're not able to use any extra label type medications, cephalosporins for any kind of uses. We do have a couple of loopholes that we can get through, but we cannot use cephalosporin's extra label whatsoever. Then the FDA guidance 209 was published in 2013, which was to look at bringing our medication, any medication that's available under veterinary use, and then guidance 213, and you put 209 and 213 together, and you have the veterinary feed directive. And I'm sure most of all of you know about the veterinary feed directive now. And this is just kind of looking at those two put together here. 209 is looking at medically important. And when I say medically important antibiotics, that means human medically important antibiotics. Antibiotics that are used on us as well as used in our animals. And the whole thought process was that there will be some resistance, antibiotic resistance built up from feeding our animals the same antibiotics that we're taking. And that antibiotic resistance would be in us. And we certainly want to keep those working. We certainly don't want to have antibiotics that are not working for us, so that when we go in for treatment, nothing's working and they're having to reach for these, sure enough, big guns that may be detrimental. Then guidance 213 was to be under the oversight of veterinary consultation. And of course, you put these two together and you got the veterinary feed directive. Quite a few of you may already be using the veterinary feed directive. I know a lot of people, when I started talking about the VFD and what was going to be involved, I heard a lot of chicken and little type things. The sky is falling, the sky is falling. And since this has kicked into gear, I've talked to quite a few producers and veterinarians as well, because golly, guys, we were scared too. We didn't know what to do. And because this is brand new for all of us. But I've spoken with several veterinarians and several producers since this has happened, and it's been kind of, golly, what were we so scared of? This is not so bad. That may not be your case in the area where you are, but certainly we're here in this area of Tennessee, not that difficult at all. And veterinarians got used to writing these VFDs and right into it. And so I hope that's been a good transition for you. So now what we have is the guidance for industry 263. And what that says is over-the-counter medications will become prescription items June 11th of 23. So we're looking at just a little over 6 months now. This will include injectables, any sort of antibiotic boluses, and intramammary treatments. I don't know if we've got any dairy producers or agents that deal with dairy producers on with us today, but intramammaries will be involved with this as well. From what I understand, even some of the script intramammary antibiotics has been difficult to get here lately. And don't think, if you're a producer listening to this and you're going, we're being singled out, don't feel alone here, because we're having trouble getting some of these antibiotics. It's not just you. Don't think you're being singled out. Us veterinarians are having issues getting some of these antibiotics. I really wished I could tell you why it is an issue. I don't know if it's the same thing as the pandemic issues, where all of a sudden everything shut down. People had to be laid off because there wasn't such a demand during that period of everything being shut down, nobody going anywhere. Then all of a sudden we open back up and people are not available. They're not able to just boom. We're not able to flip a switch and go back, crank right back up and go to full production mode like we used to. I don't know if that's the issue or what the issue is, but veterinarians are having issues getting some antibiotics as well. So don't feel like you're being singled out there. This will be under the supervision of a licensed veterinarian. You will have to have a veterinary, and we're going to talk about it here in just a minute. It's the veterinary client-patient relationship. to get that script item or whatever that script item may be. And if you look at the list, I've got a list and it's rather long. I didn't want to put that list on here today. But if you boil it down, it comes down to penicillins, sulfas, and oxytetracycline are the antibiotics that will be affected most by this new regulation. Everything else, all these other antibiotics that are out there are already script items anyway. The only other one that I can think of that is out there that will be affected by this is Thailand. So Thailand will be affected with this as well. So that's about the only one, but the biggest ones are penicillin, sulfas, and oxytetracyclines. Now, once again, don't think that food animal producers are being singled out by this. This will be for all animal owners. It is not just food producing animals. Dog, cats, rabbits, pigs, horses, everybody. So anybody walking in wanting a bottle of, I'm just going to say penicillin. You're looking for a bottle of penicillin. It doesn't matter what animal you own. You have to have a script from your veterinarian to get it. Because it would just be awfully simple to walk in there and go, oh yeah, I own horses. I don't have to have a script. And buy that bottle of antibiotics and then take it home and use it on food producing animals. So this is all animals. So once again, don't think that food animal producers are being sought out by this regulation. It's everybody. And the whole idea is, once again, the fear of antibiotic resistance building up in us, where we're using these same antibiotics, the penicillins, the tetracyclines, the oxytetracyclines, and the sulfas, where we're using on our animals, and then we consume the animals that we've used it on. So that is why this has been pushed through. This has already been done in several other countries. It's been done in Europe, I know. Also in California, it's already the case. And usually when these other countries, they enforce this type of rule, it eventually bleeds over into everybody. I can remember a veterinary student from Australia came to visit us to do an internship for about a month. And she couldn't get over it, that you could just walk into a feed store and buy all this stuff. And when I say buy all this stuff, I meant everything. They had to have a script for anything anything medical related that they walked into to buy. So ear tags, porons, vaccines, antibiotics, they had to have a script for everything. So this is kind of one of those deals that it's going to eventually bleed over into us anyway. And of course, they want this to be under the expertise of veterinarians, just so that reaching out for that antibiotic, that veterinarian would have a knowledge of the organisms and what, from a culture sensitivity, what that antibiotic is going to respond to, as opposed to just, well, I'm going to reach for this one this time. I don't know if any of you own horses, or we may have any small ruminant owners on today. But in that realm of dewormers in those species, that there is a big problem with anthelmintic resistance, dewormer resistance. And that's because people just literally walked into the feed store and picked up, hey, this dewormer looks good this time, let's use this one. Whether that animal needed it or not, now there's all sorts of resistance in dewormers. And so we want to keep it that way. We want to make sure that these antibiotics are still working in humans and in animals too. And that way you're not wasting time. If you're reaching for the wrong antibiotic to begin with, not only are you wasting time, you're wasting money and you're creating resistance. Whereas if you had knowledge of the organism, a culture sensitivity, or knowledge of what works best, then you're saving money and you're not wasting time and you're not creating resistance. And of course, this is the veterinary client patient relationship, the VCPR, that will be required for you to get these antibiotics when you go to the feed store, or you order them online. You can do it either way. The veterinarian has assumed responsibility for making clinical judgments, knowing that, yes, this animal has this particular type of condition. Yes, this antibiotic will work the best in this situation. Here's something that's important. The veterinarian has seen your animals or made an annual visit to the farm premises where your animals are kept. This is important here. Your veterinarian has to lay eyes on this animal, examine those animals, and or been out to your premises at least the past year. Now, this is going to work just a little bit different than you going to your physician. If you go to your physician, that physician sees you for, I'm just going to say, a little respiratory issue. They prescribe those antibiotics, and you go and pick up your antibiotics from a pharmacy. And then you take your antibiotics and you're done. You feel better, everything's happy and healthy, you're moving on. Well, about 2 months later, it happens again. You get another little respiratory bug. You're not able to call your physician to get another prescription. You have to go back to your physician to be examined again to get another script for whatever medication that your physician feels necessary. This is a little bit different. If this VCPR has been established, you can then call your veterinarian and your veterinarian has an intimate working knowledge of your farm. That veterinarian can now write you another script or call in another script without having to see that animal or having to come out to the farm. So that's a little bit different than what you typically would have to think of when you have to see your physician, because I've gotten that question quite a bit. And then, of course, the vet has to be readily available for emergency coverage or follow-up evaluation in case there's some sort of adverse reaction to the medication. Okay, then this VCPR that, like I said, the veterinarian has an intimate working knowledge of your farm. So if that medicine has been prescribed for a certain condition, I've had this question a lot too. Do I need to call my veterinarian just to give a shot? Well, no. If you have, that veterinarian has prescribed this medication, you've consulted with this veterinarian at a prior time about these conditions, I'm just going to say respiratory type issues, and you can clearly see the cat's got a snotty nose or a cough or something of that nature, and that medication is prescribed for a cough or a snotty nose or whatever that respiratory issue is. You can give that medication without having to call your veterinarian and give a shot. Now, I highly recommend it that you call in. Yes, hey, doc, I'm seeing this. Is it okay to give the medication you prescribed? Do you think that medication that you prescribe will be best for this condition? And that veterinarian may have more questions for you. Yeah, I think that would be a good idea, a really good idea, but it's not required. Also, another situation that I've run into, and I've had multiple calls on this one, when the veterinary feed directive kicked into gear. I've had small animal veterinarians call me and say, listen, I have a producer. I see their small animal. I'm their small animal vet. And they want me to write a script, a VFD script for their cattle. Well, if you go back and read the rules and regulations on the VFD, it doesn't say that you have to be a large animal veterinarian to write a VFD. But I strongly encourage these small animal veterinarians to be careful here. If you do not have that intimate working knowledge of that farm, even though technically, very, very, very technically, you have established a VCPR, I highly recommend that a veterinarian that writes the VCPR, or excuse me, writes the VFD or writes the prescription for this upcoming regulation, I highly recommend that those veterinarians are the ones that have seen your animals and the ones that have a knowledge of those animals on that farm. Okay, also the thought process behind this whole new regulation thing here is using those antibiotics only when needed for treatment, not necessarily for prevention. It's more so for treatment. Also, making sure that antibiotic is appropriate for the right purpose. And that's why I highly recommend you contact a veterinarian before you just up and give that medication. Also, the correct dose, frequency, and duration, and whether that be the route through the feed, water, or injection. It's making sure it's being done the right way. I always like to go over this one too, making sure you understand what extra label drug use means. And that's where you're using that medication in a manner other than its intended use. So if the drug, let's just say your veterinarian has been out and your veterinarian has examined your animals for some sort of respiratory issue, that medication they prescribe is supposed to be used in that manner for respiratory issues. Now, let's just say you come up with a cow that's lame. Hey, I wonder if this will work for foot rot or a hoof abscess, something of that nature. And you just decide to up and use it that way. Well, that's extra label. That's illegal. You're not supposed to do it that way. Now, if you call your veterinarian up or you discuss that with your veterinarian while that veterinarian's on the farm, that veterinarian writes it on the label, because what this new over-the-counter prescription thing will mean is your veterinarian will have to stick a label. And some of you that have gotten prescription medications from your veterinarian, that veterinarian should have stuck their own label on that bottle describing how and what this is being used for. So that's why I highly recommend you call that veterinarian. Let's just say, okay, it says for respiratory use only, and now I've got one lame with hoof rot or hoof abscess or something of that nature, or pink eye, something of that nature. You need to use it in the manner that's listed on the label. And that's why you need to discuss this with your veterinarian. Also, if you're giving it a higher dose than what is on the label. The label says 6 mils per 100 pounds. You decide to go 10 mils per 100 pounds. Now you're going extra label. Now you're running into residues. And this is the BQA coordinator talking to you as well. So now you're talking about residues. And we certainly don't want you getting blackballed by having an animal that's sent to processing and they find drug residues where the withdrawal period hadn't been. Because if you let me back up. If you use the dose that's on the label, that dose has been studied very well as far as how long that residue lasts. And that's why you have the withdrawal period. That's why it's very specific. The one I remember is LA200 is 28 days after the last dose. They have studied that very well to understand, yes, boom, at 28 days, that drug is no longer detectable or the levels are so low, it doesn't matter. If you give that dose higher than that or you give it longer than that, that will affect the withdrawal time. So that's why you need to follow specifically what's on the label, exactly what your veterinarian tells you, exactly the amount of times that your veterinarian tells you to do it. Also, here's another one. If you use it for a disease that's not on the label, like I just said, it's for respiratory use only, and you use it for pink eye. Now, if your veterinarian tells you to do it that way, you're covered. But if you just up and decide to do it on your own, now that's illegal. And here, basically, this is exactly what I just described. If your veterinarian has made that diagnosis by the VCPR, that veterinarian has assumed responsibility, clinical judgment You agree to those instructions that the veterinarian writes on your label, their label that is put on your bottle, and then the vet has a working knowledge of your operation. If you follow that label like the veterinarian tells you to, then you can use it for extra label drug use. Now, at the same time, if your veterinarian tells you to use this medication in extra label, let's just say longer duration or higher dosage, your veterinarian is now supposed to give you the withdrawal time. They will write down what the new withdrawal time is. So you used LA200 at a higher dose and longer than you were supposed to. Well, 28 days is not the withdrawal period anymore. Your veterinarian may tell you 50 days or 48 or 40 or whatever that decision, that clinical judgment decision has been made by the veterinarian to use it that way. Also, we have a resource that we use, and when I say we, I'm talking veterinarians, and it's called FAIRAD, and it's a residue avoidance type website. It's a basically a group that we use that if we don't know it off the top of our head, we use LA200 at 10 mils per 100 pounds for 5 doses. Well, we don't know that right off the top of our head. We can go to this website. We can enter in all the information of how we used it extra label, and then FAIRAD will get back in touch with us a couple of days later and will tell us what their recommendation is. So we have a resource that can help make our judgments there as far as how long that withdrawal period is now. Where are we going to get them? These antibiotics will still be available. They're not going away. They will just simply be required to have a script to get them. You are not required to purchase from the vet. If you wish to, that's perfectly fine. You can do it that way. I've had a lot of people say, well, you old veterinarians, you've lobbied with the government so you can jack up the prices of antibiotics. No, we have not. I don't know of the first veterinarian that was excited about the VFD, and I hadn't heard too many that are excited about this one either. But you can still purchase from your veterinarian. But we did not lobby for this regulation to come along so we could jack up prices. Now, I'm not saying that this new regulation won't jack up prices. It might very well. It's hard to ever tell what the market's going to do when something like this comes along. I don't know. I broke my crystal ball. I'm not able to look in it and tell you. You should still be able to get these antibiotics in farm stores or online. Here's something else I do not have an answer for. When this new regulation comes along, will farm stores decide to keep antibiotics and keep selling antibiotics? I don't know. No idea. I could see a place like Co-op or Tractor Supply that's a big company like this that may even have veterinarians on staff. I could see where they potentially would keep going. It's your mom and pop feed stores that may not do it anymore because now they're going to be required to keep up with a prescription. And think about it. When you get a prescription from your physician to go to a pharmacy to purchase that medication, whatever that medication may be, you have to hand that script to a pharmacist, and that pharmacist has to look at it, and that pharmacist fills it. Well, see, that's what I'm saying. These big stores, these big companies, they may still do that because, yeah, hey, that's not that big a deal to either keep my vet on staff. They can look at the script, or shoot, we may even hire a pharmacist. But mom and pop ain't gonna do that because that ain't gonna work. And then the online stores, pretty straightforward and simple. When I was in practice, I ran a mobile unit, and I didn't have a whole lot of room for storing antibiotics. So I only purchased what I needed to keep on my truck to treat something that I may go out there and see for that call. And if we decided more antibiotics were needed, I literally could get on the phone. I used MWI. I could literally get on the phone if it was before 2 o'clock in the afternoon. I could call in and say, hey, I need a bottle of Draxxin shipped to Katie Mason in Greenback, Tennessee's 123 Main Street, Greenback, Tennessee. It literally would be there the next day. It was pretty sweet, and only $8 shipping. That's pretty sweet. That made it really easy. My producers, they loved it. I liked it too because that meant I didn't have to keep it on hand. And if it was a non-script item, I'm just going to say syringes or needles or pour-on, insecticide pour-on. We could create an account, and of course I created an account anyway for my producers. And if it was a non-script item, like something like that you would buy most anywhere, they could get online, they could order it themselves, and it's shipped straight to them. So I thought that was pretty straightforward. A script will be needed in those farm stores the farm stores are online. And this is what I was talking about a while ago, that veterinarian, if you call and you need a new script or something else needs to be refilled or something like that, they can simply go online and redo it. And boom, it's at your house not too much later. That's the way I used to do it all the time. Pretty straightforward. I will say this, and I should have mentioned this when I was talking about the VCPR. Notice it says follow the context of the VCPR. I cannot establish a VCPR over the telephone. So I had this happen at CVM the other day. I do clinics. I do several weeks of clinics throughout the year. And somebody calls in and says, I have some ewes. I saw the ram mount them. I do not want them bred. Can you write me a script for some Lutalice? And I had to tell her, no, ma'am, I'm sorry. I'm not able to do that. I have not seen your animals. I cannot establish a VCPR over the telephone, and I cannot establish a VCPR electronically. So the animals have to be seen. Now, here's something else that this is kind of run into a gray area, if you will. The lady comes back when I told her that I couldn't do that because I hadn't seen your animals. She goes, well, somebody there at UT saw them back in February. Well, that's fine. Whoever saw them back in February can do that, but I can't do that because I have not seen the animals. So this is something that I kind of recommended when the VFD came out, because I had veterinarians asking me this question too. Who can write the VFD in the practice? Well, technically anybody can, but what I recommended was pick out one person in that clinic, and they are the ones that are going to do the VFDs. They're going to be the ones that sees the animals. They're the ones that's clinically familiar with these animals, the farm, that kind of goes on. So they would be more in line with being able to write that VFD. And I kind of recommend the same thing here, is to make sure it's the veterinarian that's seen the animals, their intimate knowledge, working knowledge of the farm, and it's not the vet in the practice that sees your dog or your cat. I run into this too. We can't get a vet. I often want to ask this question, and I'm going to tread some thin ice here. I often, through my head, I go, okay, can you not get a vet, or do you not want to pay one to come out? And that may ruffle some feathers, but I think there's some truth to that. But there is a website, TDA website. Here it is right here. You've got time to take your phone out. This will be recorded. You can it'll be in the recording. Take your phone out, take a picture of that. There's a listing of veterinarians in the state of Tennessee, and they're listed by county. If there's others on here, I don't know if this is just Tennessee specific or if there's other states that may be on here. Your state may have something very similar through the Department of Agriculture that you can go to and visit. You can see the large animal veterinarians that are in each county and their contact information and being able to reach them. So I realize it may be a bit frustrating. You may not be able to get a vet out, but and I apologize, but this is the way it's going to be. And something I didn't mention at the first. Yeah, antibiotic resistance, I will agree. It is an issue. We worry about it. But here's how all of this really came about. There is that fear of antimicrobial resistance. But it's the special interest groups that grabbed it and ran with it and did something with it. The soccer moms out there did something with it. And we literally sat on our bahunkies and didn't do anything about it. So this is why we have it now. So it's coming, it's aggravating, but yeah, we just got to adjust to it and we got to go. Okay, what are we going to do about it? What's something that we can do to help reduce the amount of antibiotics that we're using on our farms? Let's maximize the investment of our vaccines. Now, a lot of times we think we give a vaccine that equals immunization, and now we are protected. We are ironclad. We got that Arnold Schwarzenegger cow. Well, no. Poor management overcomes the best medication every time. So we've got to step up our game in management. Excuse me. Paying attention to everything. The devil's in the details. I don't care how good a medication you use, if they're overcome by pathogens, that animal will break and have clinical illness. So let's reduce on-farm pathogens. Let's come up with some sort of strict biosecurity measure and let's follow it. Come up with a game plan. We call it SOPs for our research and education centers, standard operating procedure. This happens, this is what we do about it. And here are the steps on how it's followed to handle that situation. You can easily come up with something for your farm. Man, this is simple and easy right here. Here's a guy, here's a guy, got visitors. Listen, I expect you to follow my farm biosecurity. Mama don't let you come in the house with nasty boots on. Well, don't let somebody else come on your farm with nasty boots on. Right here is another one. You see the sign there, and here's what the sign says. Animal disease control area. You're about to enter my house. I want you to keep it clean. Here is a mailbox here with disposable boots in it for you to put on when you enter that farm. Here's a trash can to throw them in when you leave them. Simple stuff like that. Don't let nasty stuff come on your farm to begin with. Keep the herd closed as best you can to any new additions. Test those new additions if you buy them. And know if you isolate them, I apologize there. You purchase, you isolate, you test for diseases. Make sure they don't have something. I don't know how, I run into this all the time. People that purchase animals and they don't isolate them at all. They just open the trailer door, kick them in the butt, and they're out there with everybody. How do you know you didn't just buy something? How do you know you didn't just buy persistently infected BVD? You kicked it out on your farm. And I've asked others from other states, I said, is it any better in your state? Does that happen in your state? And they go, oh yeah, all the time. So I don't know why we have such an issue with doing this. It's just something we're going to have to do. We're going to have to come up with new ways to manage. It's the same thing with the dewormer issue. Because these dewormers have resistance now, we've got to come up with new ways to manage these issues. And so good management will go a long ways towards the use of excess antibiotics or dewormers or medication, whatever it is on the farm. I didn't mention this a while ago, and I guess I could on the next here. I'll mention it here in just a second. We got different routes of transmission that these disease agents can be spread animal to animal or animal to humans and back again. We can carry these diseases. Let's just say this cow, you go to visit your neighbor, and I encourage you, if your neighbor needs help, I encourage you to go help them. Go assist on their farm. But you can unknowingly pick up a disease from their animal on you, on your clothes, and you can carry it back to your farm. So when you get back home, change clothes, take a bath, take a shower. That's easy. That's easy stuff. We also have aerosol transmission. That's where it passes through the air, close proximity, these animals close together. So making sure that our barns and stuff have good ventilation, if you're using a barn at all, but just making sure there's good ventilation. And then, of course, open wounds, there can be direct contact, open wounds, fluids, drainage from these animals. Also, there's reproductive issues. So we've got different types of transmission. Here's another one here, fomite transmission. It's where it's carried from an animal to animal through either some sort of brush or needles. I often ask the question, how many of you change needles between every shot? I might get one or two hands going in the air, but that's about it. I'm going to step on some toes once again. I don't know where we get this old cowboy way of, well, Doc, I used this needle on 100 cows. It got a little dull. I sharpened it on the side of the chute and I kept going. Why? Why do we not change needles? It doesn't take that long and it doesn't cost that much. And I'm not telling y'all to do something that I don't do myself. I change needles every shot. If I feel like there's an issue, I'll change syringes. I don't have a problem using these multi-dose syringes as long as you're changing needles. Also, what's coming onto your farm? Where did that vehicle come from? Golly, we're protecting our investment. I don't think it's that big a deal to say the co-op's coming to my house. Where have you been? I want you to wash your tires before you come onto my farm. I don't think that's that big a deal to ask them to do it. Vaccines. I think vaccination programs are going to be extremely important with this, and also following up those vaccine programs with boosters. Boosters are extremely important. We all give that one shot, but I'm always wondering, usually when I ask, there's not too many hands that go up unless they're just scared to raise their hand. I don't know. Who gives boosters? And very few hands go up. Boosters are extremely important. Think about it like this way. You go to a gym once a year annually to work out. Well, doggone, you get a little goodie out of it, but you don't go back. But what if you were to go back on a regular basis? Well, yeah, now I'm going to get a lot of goodie out of it. I'm going to have some weight loss. I'm going to get in shape. Muscles are going to be built up. Going to be looking tight. Be looking good. Same with these vaccines. If I just give one, well, yeah, that's going to give some protection, but it's not going to give near as much protection as if I come back and give boosters. And this is just kind of a general recommendation. This is pretty cool. BI's put one out. What to give, when to give it. Zoetis has got a similar one. Here's what you do, here's what you give, here's when you give it, and who you give it to. I highly recommend. I have guys call me all the time. Doc, what do I vaccinate my cows for? I don't know. What happens on your farm? Does it need to be modified live? Does it need to be killed? What kind of exposure do your cows have? Are you closed herd? You open herd? Do you have any cows across the fence from you? What's the nearest cow to you? Do you have a lot of wildlife traffic coming through your farm? There's all sorts of different factors that go into making a decision on what's the right vaccine to use and how many times to use it. And oh yeah, read the label too. The label will tell you exactly how to use these products. Something else that I will say here, remember I said these new regulations will affect penicillin sulfas and oxytetracyclines. This new regulation will not affect vaccines, will not affect porons, will not affect ear tags, any of those other medication type things that you buy at the feed stores or co-ops or online. It will not affect those whatsoever. No script needed. You can buy those by the truckload, no problem. It's only those particular antibiotics that I talked about that you'll need that. If I have any sort of dairy producer here or agent that works with dairy producers, some of the mastitis management, because of this affects intramammaries as well. And also this is kind of, I got this, I didn't realize this one, got this from our Dr. Eckelkamp, our extension agent and dairy specialist, our dairy specialist, I should say, that having some issues getting some of the script dry off medications, intramammaries. So here's something that we may have to go to here because of the new over-the-counter and having issues getting those. Looking at doing selective dry off on some cows. If that cow has a low somatic cell count, she hasn't been a problem, and been looking at that cell count, been watching her through a DHI records, that kind of thing. Do not give her an intramammary dry off product. Only do a teat sealant on that animal. Now, if that cow has a high somatic cell count, yeah, probably going to have to treat her. Probably going to have to do something with her. But if she's not an issue with her somatic cell count, that alone, just do a teat sealant and then some sort of a teat dip that is a sealant over the top of her teat to keep those antibiotics from getting in her mammary gland during her dry period. And then, of course, sanitation. A lot of this comes just back to good sanitation, making sure that bedding's nice and clean, hygiene scores on the cows, those type of things. Okay, that's all I've got here. So let me get out of this program here.
All right, so that concluded Dr. Strickland's presentation. Now we're going to open it up for any questions that you all have about the new regulations on over-the-counter antibiotics. So feel free to write those in the Q&A box like you have before, or put them in the chat. And Dr. Strickland would be happy to answer those. Dr. Strickland, do you have anything that you want to add or follow up on while we're waiting for questions?
I guess it was nice to hear the birds in the background there while I was talking.
Didn't realize it.
Didn't realize that the other day when it was an awfully nice day, and I sat out on my deck out back and the birds joined in.
Yeah, I was thinking that when I put it on, at the beginning you said, happy to be here on a nice day. And I thought, well, yeah, I'd rather be listening to the birds than looking out my window. I think it looks like it's going to snow out there, It was a
little nippy today.
A little cold. All right, any questions out there? There's one popped up, so let's see. If I have a vet do a wellness check once a year in the spring and then get a case of pink eye a couple months later, can I just call and get a script, or does the vet need to see the animal with pink eye?
Good question, Jay. When that vet comes out to do a wellness check, that vet has just established a VCPR with you. And if no medication was left at the time, that you can then call your veterinarian and say, hey, I got some cases of pink eye. Is there something you can prescribe me? So if that veterinarian has established that VCPR and they understand the working intimate knowledge of your farm, you should be able to call and get a script. Okay, can you speculate why the clamp down over the counter feed store available pharma? Good question. It's basically to put all of these antibiotics under the supervision of veterinarians to try and prevent overuse of antibiotics in
of course, going back to that, the whole reason why this has come about, the whole reason why the VFD came about, the whole reason the cephalosporin prohibition came about, the whole idea of the fear of antibiotic resistance in us from using the same antibiotic on our animals that we would use, and then we would consume those animals. Harry, thank you. That is awesome. I can literally do a 2-hour talk on reproduction. And one of the first questions I'll get, what's the best thing for pink eye? That is awesome, Harry. Thank you. Work with your veterinarian because I've not seen your animals and I can't make a recommendation. So that's where you need to work with your veterinarian. And plus, it's going to make a difference. There's several different strains of pink eye bacteria. So the antibiotic that you choose may not be what's effective. I mean, think about it, y'all. This is really, really simple. Unless you just got a bunch extra money to throw away, it's best to figure out what's going to be the best thing for the best treatment for the problem to begin with. Because I may very well reach for, I'm just going to say oxytetracycline to treat it with. And whatever bacteria is in there is not susceptible to that antibiotic. Now I wasted time, effort, and money. So it may be best for your veterinarian to do a culture and sensitivity on that eye and give a recommendation of what to use in the meantime till that culture and sensitivity comes back, because it takes about 48 hours. Is VCPR only for cattle or all livestock, horses, or all animals, including pets like dogs and cats? Remember what I was talking about a while ago? Let's just say you carry your dogs and cats to Dr. Mason in Greenback, Tennessee. She does the exam on those animals and she treats your animals, but she's not seen your horses or your cattle. This goes back to the VFD. I'm not 100% sure yet. I've still got answers that I need to get from FDA. We've got to do some education, and I plan to do some education with our veterinarians here in the state in January. We'll see conference that we have. So there's still education we got to go through, but let's go back to that VFD thing. Sure, she sees your dogs and cats, and technically, by the letter of the law, she can run a VFD for your cows. But I highly recommend to keep her butt out of a sling that she sees those animals before she ups and writes a VFD for those animals. So this is kind of one of those questions that's yet to be answered for us. So I would highly recommend that your veterinarian see the animals that they're writing a script for, as opposed to, well, I've only seen your dogs and cats. I highly recommend they see all of your animals. Okay, Tyler, good question. This is a great question. I did not mention this during the talk there. Tyler's asking, you already got them on hand, can you use this once this goes into effect? If you already have it, you can use that antibiotic up. That's not a problem. You can do that. But I highly recommend that you do not stock up on antibiotics, because this is one of those. All right, remember what I said a while ago. You've got that label that tells you how to use this, how long to use it, how much to use, and what the withdrawal time is. Well, if you've got an antibiotic that goes out of date, okay, I'm sorry, let me back up again. Remember what I said, this label and all these label claims have been very well studied, as in millions of dollars goes into this research to understand how long that withdrawal period, how effective it is, blah, blah, blah. I've had calls. What if I've got some antibiotic that's expired? Can I just use a double dose of it? Just in case it's not effective? Well, guess what you've done? You've now gone extra label. And remember what I said, unless your veterinarian approves it to be used that way, you cannot use it in a manner other than what's on the label. So now you've gone into extra label drug use. Plus, we don't know how effective that vaccine, or excuse me, antibiotic's going to be after it expires. Plus, we do not know the withdrawal period any longer. Like I said, it's been studied. They know while it's still within the expiration time. They also study that too, how long it's going to take that drug to expire. So I highly recommend you do not stock up on it. I highly recommend you do not use an antibiotic that's expired, because we just simply don't know. And the whole residue thing is what we're worried about anyway. Residues and antibiotic resistance. Okay. Yes, Kelly, that constitutes a veterinary relationship, a VCPR. That animal comes out, excuse me, that veterinarian comes out to your farm, consults with you, sees your animals, maybe even examines one or two. There you go. You've established a VCPR. Also, another way, and a VCPR can be established, is if that producer brings the animals to the veterinarian. You can establish that way. But it's highly recommended the vet comes out to your farm and examines those animals there. I wished I could remember the name of this. It's got a name. It's something blindness that we experience on our farms. We see it every day, and before long, we don't pay any attention to it. We literally walk right by something that could be a problem on the farm, and we don't pay a lick of attention to it, but you call Dr. Mason out to your farm just for a farm call, and the first thing she goes is, hey, have you noticed that right there? That could be something that's causing an issue on your farm. So I highly recommend another set of eyes on your farm. And I realize your extension agent can't do that, can't prescribe any medications, but they can certainly, another set of eyes on the farm, and they can go, hey, you realize this could be something that's causing your issue on your farm. Good questions, y'all. I didn't have any questions the other day when we did this. This is good. This is good to be able to get those things out there and understand what's going on, get them aired out. Also,
Yeah, that's
something
right.
else, and Dr. Mason, well, I guess I could type it in the chat box. Hold on just a second. Let me put something here. Here's my website right there. You can go to that website and you can send in questions. It'll send me an email saying that so-and-so from such and such county has a question. Could you please answer? And I can email back. Okay. All right, let's see. It is a common practice that pink eye medications are made from different samples taken from the area the individual's from. You can get theirs from local vet. Would these be more effective than regular over-the-counter drugs from co-op? That's kind of a yes and no type answer to that question. It's a great question. I've had producers that tell me we have vaccinated for pink eye the past 2 years, and it's worked great. We used it again this year, and we're tore up with it. That's because a new strain has come in. So yes, it did work for you for 2 years, but a new strain's come in. In a culture, to have a autogenous vaccine made up from that culture can be helpful, especially if a new strain has come in. And here's what I've spoken with producers at stocker conferences and other places that have done this. And usually if you have it on your farm, I promise you, your neighbor 2-3 miles down the road is going to have it before long, that different strain. And because what happens is that face fly that carries the bacteria around, they are related to the housefly. We know the housefly will travel anywhere from 3 to 4 miles looking for a meal. So we strongly suspect that a face fly will do the same thing. So what some of these guys would do, and it's almost like you're talking about in Truesdale, where you've got that autogenous vaccine made up in it, and it will cover kind of a big area there. And so 2 or 3 folks go together to buy this autogenous vaccine that's been made up for them, and they have seen improvement from it. Your typical vaccine, your pink eye vaccine, is going to have Moraxella bovis in it, but we're starting to find out that Moraxella bovaculi may be causing this issue as well. Hold on just a second. I'll think of Addison Labs now has a Moraxella bovaculi vaccine. Consult with your veterinarian to see if that's necessary on your farm. And I think Zoetis is trying their best to get that Moraxella bovaculi in their pink eye implant. So once again, consult with your veterinarian. They know what's going on in your area much better than I do, and they can help you much better than I can. Good questions.
Any last minute questions before we wrap up here? All right. Well, Dr. Strickland, thank you for being with us, answering questions. And like he said, there's one more thing.
One more. Kind of when you start shutting things down, somebody's going to pop up. Okay. Background and micro. The importance of antibiotic usage control, incredibly important. Okay. Yeah. And you're right. It's incredibly important in the big picture. We want to keep our antibiotics working in our cattle. We want to keep our anthelmintics working in cattle. We don't want to end up where the horse in the small ruminant world is with anthelmintics, where there's a lot of resistance. And we don't want to end up with that, with antibiotics and using that in our animals and using it in us too. So yes, it's incredibly important. Golly, guys, I know this is a pain. I know it is. Been there, done that. I was in the dairy business 25 years. So I know exactly where you are. So I know this is going to be a pain. This new regulations coming along. But as I said, with the VFD, everybody thought the sky was falling. And after everything went through, they went, oh, gee whiz, that wasn't as bad as I thought. Another one that just real quick I'll bring up. I would encourage this because I heard this at a meeting one night. Well, I will just borrow some antibiotics from my neighbor. No, y'all be careful. That's even worse. Even worse extra label. Again, the law. So I'm going to encourage you not to do that, because residues show up. They're going to show up at your house saying, where did you get this antibiotic? What vet prescribed it? And well, yeah, you're going to sing like a canary, and you're going to tell on your neighbor, and now you and your neighbor both, and probably the veterinarian is going to be in trouble. So I strongly encourage you not to borrow antibiotics or store them up. All righty. Thanks again, everyone, for letting me join in. And there's the website if you want to send any questions. Of course, you're always able to just straight up email questions as well. Oh, wait a minute. There we go again. Oh, hold on. To the class, producers sold off the overstock to meet market needs. Okay, keeping the herd healthy and cost. I can remember one time. All right, you remember a little while back, this of course was before COVID kicked in. Cattle prices, they rode market highs for a long time. And I was just amazed at how long the cattle prices stayed so high. And everybody else was going, how long is this going to stay like this? This is awesome, but how long is it going to stay like this? And then sure enough, it started coming back down. So I had questions about what can we do to, in other words, what can we cut out now that the prices of cattle are going down and still stay safe? Well, kind of one of the first things that somebody's going to ask, what vaccines can I cut out? Well, I sat down and I'm not an economist. Dr. Andrew Griffith is your economist, or Dr. Charlie Martinez. They are the smart folks. I'm just a dumb country boy veterinarian that can do math on the hood of the pickup. So I just real quick looked at, okay, let's look at vaccines. Let's just simply look at, I'm just going to say blackleg vaccine. golly, the cheapest one on the market, I believe. And we're not going to vaccinate our calves. Or you could even do one respiratory, which is, you know, a little bit more. But let's just say, y'all have to help me here because I don't keep up with the market that well. But let's just say you lose one calf. That calf would have grown up to been 1,200 pounds when you sold it. What's that? I don't know, $1,300, $1,400. I don't know. I'll keep up with the market enough to know exact, but am I right about $1,400 that you just lost? Well, how many calves or cows could you vaccinate with that one calf that you lost? Or that one cow that you lost to respiratory issues, or the extra veterinary calls that you're going to have, but just simply because you didn't vaccinate and you didn't do good management. So good management, keeping the herd healthy as possible, paying attention to biosecurity, just paying attention to detail. I really love what I heard somebody say, and this was actually back in vet school. I had an instructor that used to say, do common things uncommonly well. And that goes a long way. Just paying attention to detail, taking that extra little bit of time to do stuff will go a long way in preventing disease from even showing up on the farm to begin with. I know a surefire way to get another question. We're going to stop.
I'm not gonna ask.
Don't ask. Okay. All righty. Once again, thanks, folks.
Thanks. We'll see y'all Thursday night.